The following discussion is for educational and informational purposes only and does not constitute medical advice, diagnosis, or treatment. The content shared does not replace professional medical judgment. Always seek the advice of your physician regarding any medical condition. Now, let's get ready for HIV Real Talk, Real Solutions. I am Teresa Giles, your host. I'm so excited to be back here with you. It's been a while. We've had spring break. Everybody's been away. We're coming back. We have an exciting episode for you. Now, for our previous episodes, we've analyzed the clinical side of HIV and STI prevention. We've discussed medications and laboratory tests, the role of the pharmacist. But today, we're going to pivot from the lab to the streets. We're examining the socioeconomic infrastructure. Now, a virus is a biological entity. It doesn't possess the capacity to discriminate. So I want you to hear me. The data proves that HIV and STIs impact specific communities in disproportionately higher rates. Why? Because the social system housing the virus, they don't discriminate. It does not discriminate. Now, the hidden forces of poverty, housing instability, the systemic racism, and healthcare access, I am joined by a very special guest. And it is somebody, and I want to tell you, I met him on my first day here. And what he told me, I said, Paul, what is your goal? He said, I'm going to be CEO. And I was like, yes, that's exactly what I want to hear. Paul has been at Hope and Help for a while. He knows almost all of our departments that are here. So I'm excited. I want to welcome Paul to the program. And Paul, will you introduce yourself?
Sure. Hi, everyone. Thank you for having me, Teresa. I'm Paul Maldonado, the Director of Business and Community Engagement. And I'm so happy that you brought this topic up, Teresa. It's so important. It's a critical conversation that we need to have. If we only treat the biological pathogens and ignore the socioeconomic environment, then we won't ever eradicate the epidemic.
Absolutely not. Now, we're going to start off for our listeners. Let's define our terms at the start. Let's just get it out there. Now, in public health, the forces are called social determinants of health. Now, for our listeners, what does that mean in practical, everyday terms?
So that means that your zip code is more often a predictor of your health outcomes than your actual genetic code. So social determinants are the conditions in the environments where people are born, live, work, play, or even age. They directly affect a wide range of health functioning and quality of life outcomes and risks.
Now, I'm going to go off script a little bit because when I was little, when I got upset, I would just say, I didn't ask to be born, right? So you think about these social determinants. You didn't ask to be born in this, or you didn't ask to be put in there. So let's begin with the most immediate foundational need, housing, right? It's like Maslow's theory of hierarchy. How exactly does a lack of stable housing translate into higher HIV or STI transmission rate?
Housing is one of the most important things, right? So if we think of everything through Maslow's hierarchy of needs, right?
I like that.
If an individual does not know where they sleep tonight, how are they going to understand, okay, if I'm going to get evicted, should I take my meds? They're not even thinking about the medications. They're just thinking survival, survival, survival. So taking a daily prophylactic medication like PrEP or adhering to an antiretroviral regimen to maintain an undetectable viral load or virally suppressed viral load, drops the bottom of their priority list. Like if I don't know where I'm sleeping, if I don't know where I'm resting. Furthermore, individuals experiencing homelessness are highly vulnerable to violence, sexual assault, and transactional sex for basic needs, which exponentially increases the transmission risk.
Do we have data to quantify that type of impact?
We absolutely do have that data. Research consistently demonstrates that individuals living with HIV who experience housing instability are significantly less likely to achieve viral suppression compared to their stably housed counterparts. If you're not virally suppressed, your immune system degrades and you retain the capacity to transmit the virus. Housing is literally healthcare. Without housing, you're not able to go anywhere.
And housing is a big issue with us. Now, I want to move the conversation a little bit deeper or different, I want to say. We must address the most uncomfortable yet mathematically undeniable factor, race and systemic racism. And it is something that we try to shy away. We don't want to make people feel uncomfortable. So, Paul, provide the forensic data of how HIV impacts different demographics in the
So I'm going to read this and get the exact statistics from the Center for Disease Control. So I'm going to read it verbatim.
Great.
So Black Americans represent 12 to 13% of the United States population. However, They account for nearly 42% of all new HIV infections. Again, 12 to 13% of the United States population, but 42% of new HIV infections. Similarly, the Hispanic and Latino Americans represent only 18% of the United States population, but they account for nearly 29% of new HIV infections.
Now, to be absolutely clear for our audience, this disparity is not genetic.
Absolutely not. It's definitely not genetic. It's structural, right? So these statistics are the mathematical output of historical redlining, generational poverty, and systemic exclusion from high-quality healthcare networks. Furthermore, we have to factor in medical mistrust.
Yes.
So that's a huge thing. So the history of the American medical system exploiting minority populations, such as the Tuskegee syphilis study, has created a generational justified skepticism of public health initiatives. If a patient does not trust the clinic, they're not going to go to the clinic. If they don't trust the clinic where they go, they're not going to go and get tested either.
And I want audience to believe that study is real, the Tuskegee syphilis study. That is something, if you don't know about it, look it up. Use AI, Google it. You need to know about that study. Now, Paul, another important question. How does Hope and Help dismantle that mistrust?
So we're really good at it, I'd like to say. I've been here for a while, so I think we're really good. But we do that by ensuring our staff, the community we serve, and by placing our facilities within the communities that require the most resources. We do not demand the community come to us. We deploy our resources directly out there to them.
So we're there. We're in the community.
Meet everyone where they're at.
I love that. Now, let's shift a little bit to education. Now, we see a massive regional disparity in STIs and HIV rates, particularly in the southern part of the. How much of this is driven by educational policy?
It's direct and undeniable, Teresa, 100%. The states that mandate abstinence only, sexual education consistently report the highest rates of teen pregnancies and sexual transmission, just directly associated.
It is amazing that we still have that. Even here in Florida, we have some counties that say, no, we don't want to talk about sex education, just abstinence. And that does not work. Explain the mechanics of that failure.
When you withhold anatomical, scientific, and protective data from the adolescents, you don't stop them from engaging in sex. You simply guarantee that they engage in it without holding the tools and necessary in protecting themselves.
Exactly.
They don't know how to negotiate condom use. They don't know how to understand transmissions windows for syphilis or HIV, and they don't know the resources like PEP or DoxyPEP or PrEP. Ignorance is primarily vector for disease. If you don't know what's going on, you don't know how to protect yourself.
One of the things I found, I was speaking in front of a large class of leaders here in Central Florida. And one of the questions after I was talking about HIV, I was talking about Hope and Help. One of the questions that came from the audience said, Ms. Giles, how are you comfortable talking about this subject? And one of the things I said, now these are adults, these are not even educating our kids. I said, how are you not comfortable talking about that? And hearing just what you said about this data with education, it's alarming because if the parents or the leaders don't talk about it, they're not sending this down to their children. They don't want us to put it in the school. So that is a huge gap in education. And one of the things I think, therefore, the educational system itself becomes a structural barrier to prevention.
Exactly.
Really?
We spend so many resources trying to intervene when a patient is in their 20s, attempting to undo decades of misinformation they received during their formative years.
It is amazing. So in this short period of time, and I know the listeners are listening, we have identified these forces: poverty, lack of housing, racism, and educational deficits. Now, Paul, what is the operational strategy at Hope and Help to combat an entire social economic system such as this?
What we do is we do the whole wraparound approach, right? So it focuses on treating the whole person rather than just a disease. When a patient enters our facility, we assess their overall health, housing stability, food security, and other social determinants of health to ensure they receive fully informed and compassionate support. So for clients who test reactive, their journeys typically include, like, the first one is meeting with a medical provider to initiate that care, right? And it's not just, okay, you were tested reactive for hepatitis or HIV. It's, okay, let's get you down to the basics of health and then tackle what we're here to actually tackle, right? Then number two is to engage with case management, where the team evaluates their housing needs, their mental health, their food insecurities, psychosocial support, and more, because there are some services that people just don't know are out there for them. And then by addressing the full scope of the patient's needs, we
Right.
create a meaningful encounter that the socioeconomic barriers often get in the way of.
One of the things I say, especially when we're doing TikTok, is that you don't have to walk this walk. We're there to walk with
Correct.
you. From the moment you walk through the door, we're walking with you. And what Paul had just stated, even the full wraparound services, that's exactly what we do. And
Mm-hmm.
I believe it does. Everybody talks about it takes a village. It does. It takes a village.
100%.
It requires a rigorous, multidisciplinary approach. And that's what I love about Hope and Help. What do you think?
It's the only methodology that actually has long-lasting statistical results, because without the wraparound support, something's going to fall through the cracks and then you're at the beginning again.
Yeah. Wow. That is, I often hear people say, oh, I understand what you're going through, but that's not so if you haven't walked their walk. What I
Mm-hmm.
love about the people at Hope and Help, and I know I'm being a little biased, is that many of them walk that walk. And so when they say, I know exactly what you're going through,
Mm-hmm.
they know exactly what you're going through, and they're there to be there with you. I like that. Now, we went through this so fast, but I thank you for the forensic analysis of the forces driving the economic. The data is sobering, but the strategic response from organizations like Hope and Help
Yes.
provides a clear pathway forward. But before we go, and I know because people are like, they're right there on the precipice of just saying, wait a minute. And I want to say, if you have questions, please to us, put it in a chat. We will answer it on our next podcast. And if you're listening to us live on TikTok, make sure you ask. Paul is here every day. You can always reach. But not only do I want to thank you for being here and talking about it, it is so important that even if people are not watching us live, if people pick this video up next week or in a month or maybe in the summer on the hottest day and they're not outside, it's important that they heard you say, we are that source that can be there for housing, for food. One of your colleagues came over the weekend and sent a Teams picture of someone donating to our food pantry. And it was
Mm-hmm.
just slew. So we're there for our patients. So make sure they come. So Paul, thank you. Thank you for providing this and being here and talking with me. It's so important. And not only with me, to everyone that will see this podcast.
Yeah, thank you so much for having me, Teresa. It's been great. And we have to do that. We have to follow the data because the data is going to put us to where we're needed the most.
Yeah. Now, last time before I sign off, I'm going to give you your last words. If someone was watching and they wanted to hear, how do I get in touch with you, or how do I get in touch with Hope and Help, and what would you tell them? What would be your last words?
So my last word would be, don't be afraid. We're here to answer any and all questions you have. We have medical professionals here that if you have that extra clinical, like I need this information from a medical provider, we have that. But to get in touch with us, go on our website, contact us. It's right there. You can get a hold of us or stop on in and say, hey, I want to see Paul. I want to ask him some more questions. I'll come out to the lobby and see you.
I love that. Love that. Now, for our listeners, if you're facing barriers to care, whether it is housing instability, financial limitations, or simply a need for accurate education, contact us. Contact us at Hope and Help. You can start by hopeandhelp.org on our website. You can call us. You can message us. You can message us on TikTok, anything. Just reach out or stop by 4122 Metric Drive right here in Winter Park, Florida. We possess the infrastructure for you. We'll be there for you. Now, I am Teresa Giles again, and we will see you next time on HIV, Real Talk, Real Solutions. You want to keep watching the episodes, and thank you. Thank you for being here. We love it.